dorsal ganglion can happen at the back of your wrist and also at the volar aspect, front part of the wrist. What is ganglion? It's not a cancer. Once a month, I'll see one case. It's a benign soft tissue mass over the hand or wrist. Not only over the hand, it can happen any parts of the joint. It can be the foot, it can be the knee, at the back of your knee, it can be elbows. It can happen anyway. Today our topic focus on the hand. What does it contain? It contains a joint fluid or tendon sheath fluid. It is a gel-like structure when you puncture. So the presentation, patient will tell you they have swelling over the hand, over the wrist. It often fluctuates in time. It can be vanish, it can reoccur again. If the fluid herniated out from the joint, it also come back to the joint. So if it's inside, the higher pressure, you will feel pain over the wrist. If it come out, you can see swelling but no more pain and no discomfort. Most of the time, patient will tell you have a swelling will changes in size. If it is very big, which is very rare, it doesn't occur very big. My experience, probably the biggest I've seen is 3 centimeter in diameter. So this is how we do the test, transillumination test. We do transillumination test. If it is transilluminated like this, it means it contains a gel-like material, colorless fluid. So most likely is a tendon. If your operator or your doctor put a light over the lump and then it doesn't turn like this, it means maybe you have other problem. The finding must be like this, transilluminated. Then it will tell you it is a colorless fluid. So if it is colorless fluid, then it is a ganglion. Other than that, you have to be investigated. You have to go for ultrasound or MRI. Ganglion no need ultrasound unless the doctor suspects something. If the test is not transilluminated, then they will do ultrasound or MRI. Treatment reassurance, I will always give reassurance to patient. The answer is not surgery. Some of them, they want me to aspirate, tarik air, but 50% it will recur. Indication for operation only if pain, severe pain, neurovascular compromise. Mean when the ganglion not only at the back of the wrist or over the volar aspect. Volar aspect, it will compress the sometimes blood vessel or it can compress the nerve, respective anatomy. Then surgery is warrant for the patient. And if the swelling is really affected the activity of daily living, then we have to help them by performing surgery. But the surgery is not the answer. Why the surgery is not the answer? Because even with open excision, even we excise the dorsal, there's a 10% it will come back over the back of your wrist. Over the volar, expect 20% recurrence rate. It will occur. So that's why we tend to observe. Sometimes it will vanish for self-healing, but sometimes some of the patient will end up with operation. At the back, 10% of recurrence rate. It can happen again 10%. At volar, 20%. And ideally, it should be done under general anesthesia because we need to find the stop, the best of the tendon. Bloodless field must be a good illumination, means good lighting, and must be under magnification. This is to aim for less recurrence. But despite with the general anesthesia, bloodless field, good illumination, under magnification, still the recurrence rate is 10%. And over the dorsal ganglion at the back and volar ganglion, it is 20%. So decision to make surgery have to be catered as per to case basis.